Okay, everybody, are you ready? I am going to educate and entertain you right now. So I was talking to a client today, and she was just sort of sharing kind of a personal situation going on with her mother-in-law. She was going to be going to visit her later that evening, and she was just saying it was always a little upsetting because her mother-in-law had developed early onset dementia, and at this point it was, all they could do to kind of keep her in the house with the father-in-law. And in order to give him breaks, they went over and did kind of the evening routine, she and her husband. And it was such a struggle trying to get her mother-in-law to get into the bathroom, to go to the bathroom before bed, to get changed into her night clothes. And she fought it tooth and nail. They didn't know why. They've tried everything. They just couldn't reason with her. And it was just so upsetting to upset her so much right before bed. And so my client was just dreading it. And so I told her this story that I remembered from way back working in the hospital as a physical therapist, and I worked on the neuro floor. And I love these patients. It was mostly with stroke patients, but brain injury. And we got a lot of the advanced dementias because we had a smaller unit. And we could kind of had an area where if the patient needed to be watched, like they had to have 24/7 like supervision to be safe, they kind of brought them out and they could sit there where all the somebody could keep an eye on them. Anyway, so there was this patient there that was very advanced dementia, and she would just get so aggravated, and so she started to get kind of combative with staff. But she had also stopped eating, and they couldn't discharge her to where she wanted to go back to, where the family wanted her to go back to, if she didn't start eating again, because they couldn't do a feeding tube. They weren't going to do any of that stuff. And nobody could kind of figure this out. They couldn't get her to have Ensure. There was a nutritionist in there with her doctors, from a GI doctor to the hospitalist, had sat down and tried to explain to her what the consequences would be if she didn't eat. And she just wasn't having it. She was not there. She did not care what these consequences were, if she was understanding them at all. She pretty much told them what they could do with their consequences and summarily dismissed them from her room. So I was up there doing notes or something one day, and I witnessed the secretary at the nurse's station has that woman, we're going to call her Miss Smith because of course. So she has Miss Smith, she's wheeled outside the room in like her little geriatric chair that she can recline, and has the tray over her. And so this secretary had a tray sent up for this patient. And of course they had told her, we're not, why are we ordering trays for her? She doesn't eat anything. So we're still trying to get like boost in her. And so the secretary said, just bring the tray on up, let me give it a try. So they sort of rolled her eyes at her. Well, what I witnessed, people, this secretary, she pulled this woman up beside her, behind the desk with her, and she said, Miss Smith, I try to make these mashed potatoes, and something does not taste right with them. I cannot figure out what it is. Will you try them for me and tell me what you think? I forgot. She gives Miss Smith a little taste, and Miss Smith sort of slaps her lips a little bit. I don't think they have enough salt. I don't know. And so the secretary is like, maybe that is it. Let me see. She tried a little bit. She gave Miss Smith another little bit, and she's like, try just this last spoonful, because I think this might be something like butter or something. And so Miss Smith tries that. Then she moves on to the roast beef. Yeah, This is like a regular tray of food. This is not soft food. This is regular old roast beef, mashed potatoes, and veggies. She moves on to the roast beef, and she's like, for the life of me, I cannot figure out what I've done with this recipe. I don't know if you make roast beef. This is not the same way that it usually tastes. She talked Miss Smith through that whole tray as this secretary pretended to eat little nibbles here, little nibbles there, and try it and suggest what ingredients. And Miss Smith just gave her suggestions after suggestions about why her food was such crap and what she could do to help it and what she needed to add to it. That woman ate the majority of food on that tray because the secretary stopped trying to explain to her and tell her why it was important. She got to the Mrs. Smith that was locked inside, the one everybody was so frustrated by. And Mrs. Smith was so frustrated because she was probably a grown-ass woman and they were trying to tell her what to do. And of course she had dementia. But there is the moral of the story. Here's your education. The same thing doesn't work, just like kids. Just the same thing is not going to work with every person with different stages of dementia or Alzheimer's. Confusion, it might be transient coming out of a surgery. The same things aren't going to work, but I can tell you what's never going to work. And raising your voice at them is never going to work. Usually rationalizing, attempting to rationalize or threaten them, that's never going to work. It just doesn't. So what I have found, and actually learned this from, that was the best story ever. Because this woman, I wish I could give her her name and give her a shout out, but it was so long ago. I don't want to get anybody in trouble in the hospital, but she was just amazing. And I used her example so many times when talking to nurses and nursing aides about how they handle confused people and how they get so, the staff would get so frustrated and just, some men acting inappropriately, handsy or whatever, they wanted to yell and call them names. And it's so counterproductive that trying to get to who that person is underneath the confusion, underneath that shell, the harder shell that they've kind of formed as like a barrier protection against all these strangers that are coming at them from different directions. They don't know where they are. And so when I told my client that, and we started to sort of spitball how she maybe could handle her mother-in-law, and I suggested that maybe if she had photo albums in the house or whatever, that my client never mentioned the bathroom, going to the bathroom, PJs, none of that. It's not bedtime routine. I just call her Mom, could you come in here with me? I wanted to ask you some questions about these photo albums. I wanted to see if I could label some of these for you, and I need you to tell me who some of these people are. I said, get her standing in front of the toilet, have the toilet obviously ready. Do not start telling her what you're going to do. Go ahead and either say, here, sit down here while I can show them to you, and maybe have her pull her pants down. But if it was me, I would just pull them down slowly, not aggressively, as you're talking to her the whole time about the pictures. Give her the photo album in her hands so her hands are occupied. As you just say, go ahead and sit down while I show you this. Turn on the water. Maybe she'll go to the bathroom while you've got the water turned on and sit there and talk for a little while. And then in between pictures say, you know what, you seem chilly. Let me get something warmer on you. And then we'll go back out and sit. And the warmer thing, of course, is going to be our nightgown. And then if she's done going to the bathroom, you go ahead and get her bottoms on that are dry and have her stand up. And now come in here, and I have one more to show to you. And you go to the bedroom, sit down on the edge of the bed. Like, just talk to them, give them something exciting, joke with them, and talk them straight through the activity that they are avoiding, that they are putting up so much resistance to. Do not announce to them, do not televise, do not forecast to them what you're gonna do, what they're gonna do, or else they're gonna blah, 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 blah. Don't even talk about it. Don't trigger them with those words. Start to talk about the old times, pictures, get them to tell you stories, engage in stories, make shit up. It doesn't matter. Some people might think it sounds disrespectful. It's not. You are trying to take care of them, and in a way that is engaging them and treating them respectfully, having actual conversation and acting like they're with somebody who wants to hear from them, wants to have a conversation, to share a story, and their mind is off the thing that you're trying to bang over their heads. And you can almost get them to do anything if you're smart, wicked smart. You gotta just talk it through, yes them to death. Don't, if they start to get edgy, you switch topics, stop what you're doing, go a different direction. But my client came back to me. So that was, I guess we had that conversation at our last appointment. So she came today and she said that she and her mother-in-law have a whole new relationship. And when she walks in the door, her mother-in-law's like, she doesn't always know exactly who she is. But as soon as she says, this is who I am, and I thought we could go back and look at some more pictures, she smiles and she gives her a big hug. And now my patient's husband, who of course it is his mom, is just upset that he doesn't get the same response from mom. So, moral of the story is, everybody, we are treating people with respect. This isn't just aged people. I've had people with advanced cognitive issues, with brain injuries and strokes that are my age or younger. So if there's something you want to get accomplished, just talk to them like a friend, draw them into a story, something they enjoy, and just go about the business of doing that thing. I mean, if you need a signature, that's different, but bathing is always a big one. Toileting, eating, just do that work. It's fun. It'll work, I swear. And if it does, message me your story. Like, I want to share some more. I think this could be a thing. All right, good luck with that.